Welcome everybody. Thank you. We have a lot of students. This is great. And we have a few people online. Leanne, I think Elizabeth is online. And so this session is brought to you by our toolbox session. And so I was asked to come today and talk a little bit about this notion of commercialization and what it means in research, and particularly research with health scientists. And for those of you who don't know me, I know most people in the room, but those of you who don't, I'm Vicky Bungay, and I'm an associate professor here in the School of Nursing. And I'm also a recent Canada Research Chair, and I hold one in Gender Equity and Community Engagement. And the reason that I bring that up is that it really does matter. If I can move this down, maybe, there we go. It matters a lot in terms of positioning my work and understanding this idea of holding a Canada Research Chair, because it was through the process of applying for that I really came to understand what it is about commercialization that is becoming relevant for research, and how do we, in health disciplines in general and nursing in more specifically, think about commercialization in the context of our work and what that means. And so in that process of applying for Canada Research Chair, which for those of you who don't know is a Career Scholar Award, and so it is an award that is designed to support or invest in a particular scientist and an organization in a way to support and grow a program of research that tackles some of the social and health problems facing Canadians today. And so as part of that process, we also apply for what's called infrastructure funds. And infrastructure funds are those monies that a lot of our research grants and those kinds of things don't cover, or are really difficult to get covered in the context of a research grant. So there are things like how we design and build a research lab. So in nursing, we don't think about that, but we actually do build labs. So in the context of a program of research like mine, that's very much takes up the issues of health equity and the factors that influence inequities. A research lab is about the equipment that we use, the technologies, the space, the software, all those kinds of things, as well as how those things facilitate how we do the work and how we connect within all the people that we work with in doing those kinds of activities. And so as part of that application process, and in many other research grant application processes now, particularly in public funded research, researchers are being asked more and more to attend to the issue of commercialization and what that means. And so I had to figure out, given that I was applying for, you can see up there is the Canadian Foundation for Innovation Fund, also the BC Knowledge Development Fund, which is out of the Ministry of Technology, Innovation and Citizen Services. I had to figure out what it was about my work that had a commercialization element, if it indeed did. And if it didn't, I wouldn't be eligible to apply for those particular funds. And so, so the first thing that I did in trying to figure that out is try and figure out what the heck commercialization meant. And so over the next probably about 30 minutes, I'm going to walk you through the process of how I came to understand commercialization within my research program, how I used that understanding to apply and secure funds, and some of the implications that it has more generally for how we think about research that is designed, and not just research, but education that is designed around improving the healthcare system, health service delivery, health resources, and all those kinds of things. So what I was hoping we might do today is I'd talk for a little bit, and then we'd just open it up for some discussion. There's a few people that are probably going to trickle in a little bit. But if you do have something that's not clear, if I'm using language or terminology or something that's not clear, please just let me know, and we can get those things clarified. So, and I hope that, because I see, so it's great to see so many researchers in the room, students, that you'll find something useful, because these are things that you're definitely going to have to pay attention to and think about, not just in research, but also in education, and how we kind of think about this process it is a huge part of our strategic priorities in BC and also a part of our strategic priorities here at UBC. So this beginning place was, what's commercialization? What does it really mean? When we talk about health research, what's that concept got to do? Is it the same thing that Estee Lauder or Chanel might have? Are the expectations the same? And yes and no is the short answer, more on the no than the yes. But commercialization in the context of research has been really taken up within our tri-council funding bodies, which are publicly funded organizations that support research and education. And so they have worked together to come up with a commercialization and innovation strategy. And in that process have come to a definition or a description of what commercialization kind of means. And they put commercialization and innovation together. And basically what this refers to is the knowledge translation processes by which research is translated through knowledge, expertise, and skilled people between the science base and its user communities, contributing to the economic competitiveness, the effectiveness of public services and policy, and quality of life of Canadians. So while we tend to think about commercialization purely in economic terms, we can see that's not actually it's not the limited concept in that context within health research. And tri-council funding in Canada, there is a impact piece that's very much relevant, and it's not all about profit. So as we think, it's important to think about that as I kind of go through the rest of these things. So given that commercialization is about knowledge translation, it's about the connection between research activities and the users of research with regards to promoting a quality health system in Canada, it then became important to think about, so what are the overall aims of commercialization? And when I talk about this, I'm talking about it within regards to publicly funded investments. And so the aims of commercialization within a research endeavor are really to harness the publicly funded investments in health research. And that's a really important point, and I'll talk about that in a little bit, but it is about thinking about return on public funds, the investment in scholars, in educational institutions, and in activities. And commercialization is about what is the return on those kinds of investments. And the goals around commercialization are to improve the health of Canadians, to build a sustainable, evidence-based, leading-edge healthcare and public health systems, develop transformative technologies. In Canada and many parts of the world, the issue of technologies is here. It's involved in most of the work that we do in some capacity, and how can we maximize, capitalize on that within the concepts of health systems and health service delivery and individuals' health. And it's also about finding solutions to health problems and contributing to the economic growth, investment, and high-quality jobs. And so these aims within a research context can mean very specific things, and I'm going to talk about how I took those up to try and navigate some of that in the work that I did. So this notion of investment on, or return on public investment, it's actually one that it's important to think about. It's important for all of us to think about. So many of us, well, all of us in this room, are funded primarily through public funds, or in a large part through public funds. And so, for example, in what we do, about approximately 54% of BC post-secondary institution funding is through public funds. UBC in the last report, and I don't have all the exact details, receives over $500 million a year in public funds to invest in our educational programs. In the School of Nursing alone, and some of these numbers are a bit gray. Marilee's been working hard to try and figure all these out, so we'll take these as estimates. Over the last couple of years, we're looking at about $11.7 million in investment in research health here, where the principal investigator is here, and just about $58 million for researchers engaged in any role. And on any given year, particularly this is doctoral students, and our doctoral students receive between $100,000 to $200,000 a year in investment in terms of supporting their education and training and building their programs of research. So as I was working through this, what I came to understand commercialization to be was very much about how people were talking about and thinking about what would be the tangible things to think about as outcomes when we are investing this kind of money in public institutions, in education, in nursing education, in nurses practice, and nursing research. What is it that they're asking for on the other end? And thinking about commercialization in a very broad concept with regards to those key aims that I mentioned, which include economic prosperity and job creation. So this slide has a whole bunch of pictures because there is a lot of activities that are associated with commercialization. And it's not like there is always one outcome or one output, but there's many activities embedded within commercialization that we can take up in our research that actually speaks to the fact of what we're actually doing. And it's not that every project or every activity or every educational activity has to have all of these elements. And I tried to figure out how to talk about it. Was it a continuum? And was it a Venn diagram? And it got really, really messy. So I just put up a bunch of pictures and we'll kind of go with there. And I'll just kind of speak to a little bit of each of these elements. So one of the key aspects, of course, is research. So research has as its base, one of the bases, if we take it, how it fits into commercialization, it is the foundation of commercialization, and it's research to action. And so those things are very important. It's on the other end, you have a marketable product, output, a patent, a business, a spin-off business, or a product that may be marketable for profit or isn't necessarily a marketable for profit, but is something that can be shared and distributed through the entire healthcare system or every school of nursing, in which then it helps people to do their work differently to promote health and quality of life. So it does have those kinds of elements, but not all commercialization activities have to lead to those elements. Fundamental to commercialization is partnership, and collaborations, and that is about who we partner with, who we collaborate with. So if you go into, for example, the Tri-Councils, so SSHRC and CERC and CIHR right now, they have a statement, they have a whole program in the Center for Commercialization and how to build those partnerships. And those partnerships are across the country, and they're doing all kinds of creative and innovative things. We house 5 of these here in Vancouver. And some of those are attached to vaccine development. Some of them are attached to technology and healthcare. And what those partnerships are isn't necessarily all about, as I said, profit, but what they are about working with the organizations that create the technologies or have these other huge sources of funding and ensuring that the science is moving with our academic researchers here at UBC and other universities is moving in a way that there will be a benefit with regards to the health system. So other parts of it are about, a huge part of commercialization is about talent and capacity building. And so one of the things in any type of commercialization endeavor is that you're building capacity so that you are fostering people to learn, to grow, and that you are working very much towards having the right people in the right training programs in the right areas to build their talent in things that can continue to move things forward. And another element of this is job creation, and that is, I can tell you in every application that you have to speak to commercialization. Job creation is a very important component of commercialization within that context, and that can mean many things. It can mean a new industry, or it can mean about changes in the health system that actually create the right jobs with the right people prepared to actually do something different. So it's all of those kinds of entities. It's not without its problems, but it is more than I think we think about sometimes in that kind of big picture. So I didn't know what to call this, so I call it the bottom lines that I took away from this is that commercialization in health education and research is about optimizing the public investment in these endeavors to positively affect health and to support the Canadian economy. Not all research has a marketable potential, nor is it necessary. Nor is it necessary for every research activity to say it's related to, has a commercialization component to it. But the key is to consider the application of our work for improved health systems, policy, practice, and the economy. And harnessing the partnership and collaboration potential for improved funding, research, and practice creates new possibilities to advance excellence in our work. And this is a huge push right now, and it's not a fad. It's been around for a long time. But how do we actually partner up with the different industry organizations, health services, healthcare sectors? We've been doing a lot of this for a long time. We've never framed it in the language or under the umbrella of commercialization, but it definitely has an element attached to it. So that's my take in very short briefs on how I came to understand commercialization within my own sort of area of research, and how I could think about then what it would mean in terms of applying for infrastructure funding to support developing and growing a research center that was based in Canada, that was based on the deliverables of my Canada Research Chair Award. And so I had all kinds of different examples for today, but decided that I would take the BCKDF funding application because it is the one application where you have to talk about commercialization. And you cannot go forward without it. If you don't, it's an automatic. And so, and in that, so this is a pocket of money that isn't limited to Canada Research Chairs by any stretch, and it partners up with the Canadian Foundation for Innovation funds, in which what you get, you have to match each other up against each other. And so the CFI funds are federal, and this is provincial, and this comes from our provincial government, and the pot that I would be eligible to fit into is specifically from the Ministry of Technology and Innovation and Citizen Services. And it's embedded in the BC economic strategic plans and priorities, and it is embedded within the bigger plan around job creation in BC. So when we think about that, and we think about what research and education would be about, how does our work fit within that? And so they actually have 3 criteria, and they kind of took elements of commercialization and teased them out to highlight commercialization overall, and then the other 2 elements that are very, very essential. And that in applying for this, you must show how your work, the project, aligns with the following strategic priorities, and that is commercialization, talent development, and job creation. And so here I was with all of this. I'm learning about commercialization. We had a conversation in January, I think it was, where the Dean for Faculty Applied Science introduced the idea of commercialization within the strategic priorities for the faculty and the university. And I'm in this position simultaneously trying to apply and dance this and figure it out within the context of the larger picture, big picture of my research program. And so my Canada Research Chair is in the Social Science and Humanities Research Council of Canada. And so in that process, some of the languaging and how we position health looks a little bit different than if I'm positioned solely within CIHR. So to figure out how to do that and to make sense about how you might do that in your work, or things we need to think about as we go into the future, thinking about funding and those kinds of things, it's worthwhile to think about what the program goals are for my research program. And so, as I said, my program of research is very much concerned with promoting health equity. And it has 3 sort of key goals, and it's illuminating the complex and multidimensional processes embedded in the marginalization of specific subgroups of men, women, and transgender people in society. It's concerned with generating knowledge that can address these processes and enhance more effective and just policies, programs, and practices to promote people's full inclusion. And that includes interventional work, and a lot of what I'm moving towards is all based in intervention. And it's also about developing innovative methods to ethically generate knowledge for policy and practice. How can we grow some of the issues around the science with regards to advancing how we actually do the work of addressing health inequities? And so thinking about that, and it'll in terms of how I do things, there's specific areas of exclusion that are relevant for my research program. And the reason I put these up is because thinking about how this actually fits within commercialization is important. And so the areas that I focus a lot on are around the exclusion of people with regards to material, economic, and social resources, exclusion within the context of health policy, services and providers, and in legal protections. So a lot of the work that I do is addressing a lot of the issues that have to do with people in our society who are not afforded the same legal protections of other members of society, either because they are positioned in a very stigmatized location, or they may actually, some of their actions may be criminalized. And so all of these kinds of things become very important to think about within a program of research and the activities that I engage in. And I don't know if you've ever seen this. It's one of my favorites, this picture. It does one of the best of the difference between exclusion, segregation, integration, and inclusion. And I'm happy to share that with anybody and answer any questions as we move on. So here I am. I'm funded through SSHRC and CIHR, and I'm doing a lot of work around organizational and operational features and the work environments for people engaged in the commercial sex industry, do a lot of work in harm reduction and for people who are street involved, and thinking about those kinds of things and how to actually think about that and what aspects of the work that I do in that are actually relevant to commercialization, because not all are by any means. And so there's sort of two key areas, however, that helped me to think about commercialization of my work. And sort of the two aims were to develop technological advancements in secure storage, management, and analysis of large volumes of unstructured data. We have a huge gap in Canada, not just Canada, but around the world, in how we actually deal with unstructured data in big data, in big concepts, or even any of you who've worked with a data set, a qualitative data set over 50, it gets messy. And our technologies are not great when we start to put in all of the policy, all of the presentations, all of the articles, all of the pieces of the puzzle, nurses' notes, all of those kinds of things that come into that. So that's one piece of the work that I do around the methods. The other piece is around data security, and that's a huge issue because it not only is it an issue for what I do, but it's an issue in general. But data security is particularly problematic when you're engaged with people who may be identified as being engaged in quasi-illegal activities, as well as we have a case in Canada that where researchers' data has actually been subpoenaed through legal channels. However, I'm happy to announce that that case has actually set precedent that research participants are afforded the same confidentiality as other members of society and other activities, including client and patient confidentiality. The other piece of commercialization that was active for me was developing digital and screen-based media advancements in the fields of e-health and e-learning. Many of the populations or communities that I work with don't want anything to do with the healthcare system in a formalized one-on-one kind of way. Their experiences have been incredibly negative. And so how we sort of start to build capacity and start to engage with regards to e-health initiatives, it becomes very, very important. Not only is it relevant in terms of how they engage around healthcare, but also the e-learning that goes with that, and how we can support and build capacity on a very large scale with regards to how to develop effective e-health interventions, and actually what kind of education is needed to support practitioners to engage at that level. Because right now, a lot of what we're seeing is that in the new e-health initiatives, there isn't specific training about being an e-health provider. And what that means for our nursing practice in particular, since we're usually the ones who are on the other end. We're just it's seen as an extension. But what it means and all the pictures of the puzzle and how we actually get people to have meaningful engagements with people online, how does that actually work? And it's different. It works different than a one-on-one. So those are the two kind of big ideas that help me to think about commercialization in the context of my CRC application. And then I had to figure out, so what were the commercialization activities that I actually had to speak to? And how was I going to, for lack of a better word, sell it in terms of the funding, and not sell it in a bad way, but also in a way that was very authentic to what I was actually doing, and the fact that there is a commercialization aspect to the work that I do. And so these were the key activities and key issues around commercialization that I saw and took up as relevant and important within my research program. And that through applying for these kinds of funds, these are the areas of commercialization that I will specifically develop and focus on. And so, and I'm just going to go through these a little bit for each of them, just to give sort of a bit of context. And so intellectual property, there's a whole lot on intellectual property, but specifically what I was talking about here is that hopefully one of the projected outcomes in the work that I do is helping to, as I said, to develop methodological advancements around data security, management, and analysis with unstructured data. And so that kind of thing comes with intellectual property. That doesn't mean I'm looking to make a profit, but it is about understanding what that intellectual property is, and understanding the implications of that as somebody who's funded publicly to do that kind of work. What does that mean, and what kind of product is created within that, and how can we then use that to move it forward so that other people have access to those methods, to that technology, that kind of thing. Stakeholder involvement is a fundamental part of commercialization within my work, and that's collaboration with technology industry partners that include in-kind contributions in the research lab and the design, testing, and evaluation of programs. This is actually something that for me is really, really important. So if NVivo is not meeting my needs, it's great to partner with NVivo to say, how are you going to develop your technology differently so I can use it? Or if not, who do I partner with to help me design the kinds of programming that's needed to do the kind of data analysis that I want to do with huge, large amounts of unstructured data. So if I have 300 policies, interviews with 400 people, and I have every presentation that's ever been done, every research grant that's ever been done, how do I merge all that together to do something useful with that? And I cannot do that without partnering with people who have that expertise. Those can be academic partners, those can be industry partners, but it's those kinds of things are very, very important if we think about what our outputs are in terms of as a nurse scientist. Talent development is incredibly important. It's what we do. That's what we do in education. It's what we do in all of our education training and support of students. I'm speaking specifically about preparing new researchers. There's a lot around, as I said, preparing researchers for our students for practice. And so other pieces are about and around talent development is enhancing capacities for information and communication technology sector. This is one of the single biggest investments in the BC economy right now. This is where BC is spending a lot of its money, and trying to figure out how we can actually be a leader with regards to ICTs. And for me in particular, it's around that innovation around data loss breaches in security and other privacy threats. How many people have lost data ever? How many people lose email? How many people lose those kinds of things? And there's solutions to that. Our data crashes all the time. There's folks here in the room who work with me who lose them. We find it eventually, but we don't always find it all, or the most recent when we're coding and those kinds of things. And data loss is a problem right across the world. It's a big, big issue, and the more complex your data, the more challenging it gets around not losing data. And as I said before, and it's building talent in those areas is building capacity. So I'm never going to be the guru in data security, but I certainly will have a lab where people building those skills can learn and grow in collaboration with others. And so those kinds of things are kind of what we do. Maybe somebody here can do those things. The other thing around talent development is capacities in e-health, as I said, e-health-based interventions. It's if my research program includes those kinds of things, then it is around developing and working with to grow the capacity of the nurses here who come and study with us to actually be the interventionists in that kind of work, or continue to expand and grow that out as a valid method for health service delivery, not just sharing of information and kind of thing. And job creation. Everybody here who works in the School of Nursing and is about job creation. It's what we do. We prepare people, and we are all invested in understanding what types of work are required in the health system. What is the work that nurses do? How do they do it? That's one piece of it. And then there's the very micro of actual what it means in terms of the jobs that are created through research within the university and through education. So our programs create jobs. We all have a job, or because of these kinds of programs. So there is this piece around not only do we hire students within our own discipline and others and graduates from other programs, we also get hired. We create opportunities for people like me to be here and all of us. It's also ongoing technical support for the infrastructure. Somebody's got to manage all this. I am not an IT genius. Somebody has to help manage this and be part of that. And it does, and as I said, ICTs are a huge part of the BC economy. In order to support that kind of infrastructure, there's an IT technical support. There's also the support that the university provides in the infrastructure. So that is job creation. Every time we get a bit of money, publicly funded, so does the university. And it creates jobs to support and sustain that kind of thing. And also job creation in e-teaching and e-learning opportunities. People will have to do this work. And we'll be designing and thinking about what that work needs to look like, but it needs to get done. And that creates opportunities for people to actually do the thing. And the jobs have to be meaningful. I put this particular cartoon in, this idea about, it's not just job creation in this sort of, as long as it's a job, it matters. It has to be a valuable job. So when we think about contributing to the Canadian economy, it's about having jobs and people in those jobs who actually improve health systems within our acute care systems, our public health systems, all of those kinds of things. So what does it mean? How does that translate into health equity? It does. I think it does. We'll have a conversation about whether you think it does. But it does in a variety of ways. It is through these kinds of processes and activities that have this commercialized element, I'm able to work towards improving knowledge to support evidence-based policy and practice on a big scale. It's also active engagement with communities in all parts of the research process to promote self-determination. So inclusion and marginalization are very much about having the right to be involved in those things that affect your everyday life. And for a lot of people, they're not in certain policies. And so the community part, the stakeholder part, the partnerships part, and I know I talked about industry partners, but all those kinds of things actually build into that to promote health equity. creation of a world-class training environment for those tackling health inequities and all of its related factors, and enhanced interdisciplinary work. So these activities that I've pitched and within this commercialization are very much about interdisciplinary work. Health inequities cannot be resolved by a single discipline. The issues are way too complex. And so those of us in nursing have something particular to bring. Those of us in public policy have something to bring. Those of us in medicine, those of us in in sociology, all those kinds of things. Those of us in computer science all have something to bring. And so these kinds of opportunities and thinking about how we actually take up commercialization, help to foster and facilitate interdisciplinary work that we might not necessarily think about in some of what we do. So as we think about the future, one of the things is that there is no doubt that we all, if you're applying for funding in a lot of the different different programs now, you will need to speak to whether or not commercialization is a relevant aspect of your work. It doesn't mean all of your work needs to be. You need to understand what does commercialization mean in the context of healthcare education and health research, and for me in the broader social science research as well. And when we think about that, it is about what are the elements that are relevant. Industry partnerships are hugely relevant. And it doesn't mean that it doesn't mean you sell out. You know, we think about these partnerships as bad ideas, and it doesn't mean that. There's great guidelines, there's great models of how those things kind of work, and there's those models and how you engage in those models are very much, there's lots of e-learning with regards to the tri-councils around how you actually do that. It's also important to think about the work that we do and how it translates into understanding that health equity is better for Canada, because we still have a long, steep climb to convince a lot of Canada that health equity is actually better. It's better economically, it's better socially, it's better quality of life, those kinds of things. It's also really important to think about this in the context of nursing education and innovation. So one of the things, for example, is that imagine simulation. Imagine simulation. It's a fundamental part of nursing education. Imagine a partnership with one of the companies that designs all of the stuff for simulation. And again, those partnerships it's not about, oh, you have to do it this way. If you are instrumental in informing what simulation gets designed, gets tested and delivered, we then become a world leader in nursing education and simulation. But there's no way to do that without partnering with the services, the organizations that actually design those simulation activities, those models. It's very, very difficult to do it without those kinds of things, because if you don't, how are you going to change their system? It's KT. It's integrated KT. It's having the stakeholders involved from the outbreak. But it is about developing something that has meaning not just for us, but for everybody. And I'm just using that as an example. I'm not saying we should go jump and do that. I'm just saying it is one of those core things to think about with regards to if our mission is around excellence in education, practice, and research, what role does commercialization, if any, play in that? And how do we use that to optimize the types of things that we do so that our work gets translated into better education, better graduates, better healthcare, better research, and a better healthcare system? Thank you. I'm really going to mind your way. They can hear me.
So we'd like to open to questions, both from people in the audience, but also remotely. So for people who are online, if you want to type in your questions in the chat box, we'll read them off as they come in. But while we have people in the audience, maybe we'll let the live audience go first.
Okay. I knew you were going to put your hand up. Gertie.
I was curious, Vicky, thank you, and truly congratulations with the broader success of this endeavor to bring this initiative to the school. It is good, like you explained, both the message and for education and research. And what I was probably curious about is that whether you could speak to how you stimulate your work within the Tri-Council configuration, because you started out with saying how CISR sets this agenda around commercialization, but then your project is actually based in Zurich,
Right.
which has no history over the last decade for trying to remove health out of their agenda. So now I thought, hey, this is interesting.
Yeah. So just for those online, it's if I'm hearing Gertie's question, it's really about how do I position my work within the Tri-Council, recognizing that I'm funded through CIHR and SSHRC. My Canada Research Chair is SSHRC, and I hold research funds as well in SSHRC, and also research funds in CIHR. So the reality is, and I think I probably didn't clarify, is that the commercialization is a Tri-Council mandate. And so so the definition that I put up, which is taken from a CIHR website, is actually supported by SSHRC and SSRC and CIHR. And so, and these centers for commercialization are shared between all of the councils. So there's that piece, and that commercialization is right across the board for those. So that's, they do, yes. So, and where they tweak it is around the health. So in SSHRC, they'll position it around quality of life and well-being, but all the stuff around the economy, those kinds of things, they're the same. And so, and NSERC does the same with a little bit more towards sort of some of the technological kind of stuff. But they came up with these definitions. My understanding, and I could be wrong, but they came up with these together. And so for me in positioning my work, so it's that, which is, so for those of you who don't know, a few years, I guess it was 2006 or something like that, or 8, yeah, 2008, SSHRC stopped funding anything that had health in it, or was perceived as should be funded by the Canadian Institutes of Health Research. And so, however, that being said, they continue to fund and are very much invested in programs of research that are about quality of life, well-being, and the social processes that contribute to lower quality of life. So I was able to position my work within the context. How I've done this is as an interdisciplinary researcher. So my discipline is nursing, but my work is interdisciplinary in that, and so all of those pieces of the puzzle come. And so, and I, in my application, was able to argue that these pieces are specific to health and well-being, and these pieces are kind of, are related to that, but they need investigation within their own right. And so what I've had to do is kind of create this, I won't say diagram, but create this vision of a research program that allows for all of those pieces of the puzzle to come into play together. I've never said I don't do health, but I have. It's what gets privileged in the different types of funding, and what gets secondary, and how you switch them around. And because my work is very much concerned with not limited to, so when I think about, when I talk about service delivery, I'm never limited to health services, because so much of the work that I do is not embedded in an acute care system, but is in a public health system, of which public health in its very nature is intersectoral. So it all overlaps together. And so those kinds of things allow me to navigate between all of the difference. And you know, not NSERC yet. but you can see the fit, right? You can see those kinds of pieces that will come, or somebody else will lead, and my work will support them to do some of that work with me. So they will lead it, but I will be able to use or engage with the work that we're doing to help somebody grow in that particular type of area. Does that answer it? Sure. You can ask more. It's a dance. Oh, I'm just going to go. I think I have someone. Wow, that's a long question. Okay, excellent and thought-provoking. You've given us a lot to think about. That gives me a million new ideas. One odd little question. When you were writing your application, since you do research around commercial sex work, did you ever address the notion of industry partnerships with that particular industry, and why that's clearly an unethical idea as a starting place to moving on to the kinds of partnership with industries that are not ethically problematic? Oh, okay. That's a great question. Thank you, Elizabeth. Actually, in my research application, I talk about partnership with sex work communities really explicitly. And I don't necessarily, and it's very clear because one of my goals is around self-determination, that and a lot of my work is very much embedded in community and community-based research. And so I framed it within that context, in that given that marginalization really is about exclusion, and exclusion of people from policy, practices, and resources in a way that limits their ability to be more self-determined about the things that affect their lives. So in that program of research, I actually talk about it very much about a community-based research model with some of the sex worker organizations that I work with. And so I didn't spin that, for lack of a better word, I didn't position that in terms of commercialization. Where I did actually bridge it into, though, is that why people who are working within sex worker communities, so sex workers engaged in communities, should take the lead on some of the e-health initiatives and be the facilitators within some of that with regards to the launch of that kind of thing, and around advocacy work, and as well as providing support and resources to other people around what kinds of things are available for people engaged in the sex industry. So one of the things, for example, in the deliverables, and these are kind of funny applications because you've got all these bits and pieces, but one of them is around this idea of having an online network led by sex workers that would allow them to communicate and share information around resources and those kinds of things, and that they could then, with sufficient investment in public funds, they could then launch, move forward, and sustain, and have a sustainability program by which that service could be sustained, and that it could be linked in where appropriate to our current online e-health kind of initiatives, but that there was something unique that goes there. I think that answers what you mean. And I guess around the ethic, in terms of ethically problematic, one of the big things I think around working within the commercial sex industry is it is a commercial endeavor. It is complete commercialization in terms of the industry that I have been involved in. It is around jobs and money and economy, and it does contribute roughly about, we know in the U.S. it's a multi-billion-dollar commercialized industry that translates directly into the U.S. economy, and we're probably just a little bit lower than that in Canada. And so taking up those ideas will be something that I will do more in the work that I'm doing and thinking about that, but this is as far as I got at that point. Thanks, Elizabeth. Lovely.
So my question, and I know some people are going to go, oh my God, you're a nurse, but you kept saying, this isn't for profit, this isn't for profit. But in the U.S., nursing, they do a lot of work for profit and commercialization. And I'm wondering if you think in Canada, like some of their education programs and all those things, they have it funded. So there is, even with King County, some of the public health work that they do, it's a funded program and you're paying in a certain amount and you're getting money out of it. I'm wondering if you think Canada is going to start moving that way, where we are going to take our nursing education and actually make it for profit, allowing buy-in, allowing for people to have, not be so dependent. It's for nurses to be more independent practitioners.
Yeah, I mean, there is, I guess there's sort of two pieces to that is we do have an independent market. Nurses do, I mean, there's lots of nurse-led companies that we have in Canada. A lot of the home care, extended care are actually for-profit kinds of things. And I'm not saying that in terms of should we or shouldn't we, I'm in the, I would never say that nurses don't have the right to start their own company and do those kinds of things. What I think for me, the recognition in terms of my work, and then I'll speak to nurses more generally, is I'm publicly funded. So in my publicly funded research, in my publicly funded academic appointment, I have an accountability to the public that funds me. So the accountability piece in commercialization for universities in this way, because of the way that we're funded, there's a piece that is we're accountable back to that. And so we are an investment. If we think about it in very practical financial terms, every nurse that is working within a publicly funded system and has her salary, her or their salary publicly funded, has an accountability to that system in some way. Should a nurse or nurses or nursing want a different model, then that is something that I think we're into a whole lot of issues. I'm not saying that nurses shouldn't start their own business or do that kind of thing, but whether nursing education should be, I mean, it is a commercialized endeavor if we think about it, but it's a publicly funded commercialized endeavor. And so there is stuff that we do for profit. There is stuff that we do for cost balance, those kinds of things. But I think it's beyond me to say that nursing should or shouldn't move into this for-profit kind of thing, because if it's a commercialized business or enterprise with regards to for-profit, then we need to think about what that all means, and it needs to be positioned in the bigger context of a publicly funded healthcare system and how we would juggle those tensions and those kinds of things with regards to what nursing education is designed to produce, like that return on investment is a nurse to go work initially in that undergrad, and then how we think about that. So I need to think a lot more, and we have programs that are definitely for profit in nursing. We have education programs, have lots of programs that are for profit, and that is juggled very carefully against what is publicly funded within a faculty, for example, and what is not. And so how we balance those things against each other. I don't have an answer because we are a public service, right? There was a question that was asked about nursing and commercialization more broadly, and then how this all fits within a healthcare system that has privatization and how that kind of works and these things match up together. Right. I mean, we do have those kinds of models. Definitely. Our healthcare system, the finance, so I think it's different if we separate our illness system, right? So we have a healthcare system that is an illness system, which is very much privatized in its own way around a fee-for-service and those kinds of things, and versus our broader healthcare system, which has that preventative piece. Like if you go on, it's going to be a really interesting conversation, which is, I think, why nurses need to take up commercialization and think about it, because one of the things is that you cannot change what's happening in the commercialization of healthcare if you are not in the conversation about what commercialization means in our education and research. You can't do it, because if you go to CIHR, for example, or NSERC and look at their commercialized centers, it is about technology. A lot of it is about technology. It's not preventative. It's actual treatment technologies, right? So it's there's this huge piece when we know that prevention works. So there's all those kinds of issues that I think at the health system level that are being discussed, debated, but we've been woefully absent from that conversation. And when we think about our mandates, our scope of practice, our code of ethics, those kinds of things, we have to be at that table. And we haven't been. We've either said, no, it's not us, all commercialization is bad, or we're going to do this or we're going to do that. But those conversations are happening at a federal and provincial level, and we're not shaping them. So I urge everybody to go to the centers through the, it's the commercialization and innovation stream within the Tri-Council and see the centers that are there. And not a lot of it is preventative, right? It's in this illness model. So there's those kinds of pieces as well. So thanks, everybody. Thank you.